Can you tell us about the management of thyroid endocrinopathies associated with ICI therapy? What is the approach to hormone replacement and titration? So it's important when you're giving ICI therapy that we do a baseline laboratory panel, and we're going to be looking at the general functions, CBC, chemistry, but we're also going to be getting baseline thyroid function, because it's not uncommon to have a change in thyroid gland function, and that can be hyper or hypothyroidism. So we want to know what the baseline TSH is. We'll also do a T3 and a T4. Patients can have subtle changes, and we're going to be monitoring your patient every cycle that they come in, but they may have changes such as weight gain, fatigue, dry skin, constipation, which would indicate a possible hypo or low thyroidism. So we can easily test this with the blood test. Hyperthyroidism would have the opposite symptoms, such as weight loss, rapid heart rate, nervousness, irritability, maybe diarrhea, which could take us down another path, but it's important to do the TSH to figure out what's going on with the patient. So with hypothyroidism, you will see an elevated TSH level. And for these patients, we generally can manage them in collaboration with an endocrinologist. And it's important that we monitor and titrate their levels. So initially, patients will be treated with a Synthroid type medication, and then we'll be monitoring them maybe every other week, every month, until we find their stable level of thyroid function related to that medication. Patients during that time of hypothyroidism will have a hold on their ICI therapy, but oftentimes we can reinstitute it once these patients are stable. Now, the other thing to remember is, as you're educating your patient, is that these patients will be on thyroid replacement for the rest of their life. They will need to be monitored, and once again, we like to do this in conjunction with the endocrinologist. So if there are changes of titration, so we need to give more or less, that the endocrinologist is the driving force behind this recommendation.